Sharp Rees-Stealy is now rolling out outdoor respiratory centers to help those suffering significant symptoms from coronavirus. And joining us over the phone right now is Dr. Phil Efantides, Medical Director of Urgent Care at Sharp Rancho Bernardo. Thank you, Dr. Efantides, for joining us today. We know you just opened this center. What are you seeing?
Well, thanks for having us on, Kimberly. We opened this Friday, March 27, and we actually have this launched at all of our 5 urgent care sites at Rancho Bernardo, Sorrento Mesa, La Mesa, Downtown, and Chula Vista. At each of our urgent cares, we have 4 to 5 tents set up, and we are fully prepared to see those with signs and symptoms of COVID who are in high-risk categories, and we are following the CDC and local health department guidance on who to test and who to see.
Can you talk a little bit more about that? You're talking high risk, those with underlying conditions, the elderly. Who should call you or perhaps go to this outdoor tent situation, and who should try to go to the emergency room?
So we want to see folks who have signs and symptoms of COVID, specifically fever, cough, shortness of breath. The guidelines indicate those who are hospitalized, so that testing will be done in the hospital. Residents or staff of long-term care facilities, other people at high risk for severe infection, like older adults, age 65 and above, or individuals with chronic medical conditions like diabetes or heart disease or lung disease. We want to touch base with residents or staff of correctional facilities or other congregate settings like homeless shelters. And we want to test and see folks in the healthcare industry with signs and symptoms compatible with COVID. However, we don't want folks just walking in. The first step is to contact your primary physician. You will have a telemedicine visit either by phone or by video, and we're doing about 2,200 of those per day at Sharp Rees-Stealy. And then if indicated, if someone is significantly sick, the primary care physician will send that person to see me and my staff all suited up in the tents.
So then we would assume there's so much talk about testing that you have plenty of tests then for those people you see?
We do have more tests than we had last week, and every week the situation is improving. However, we are still only testing the category of patients I just went through, and the way to get assessed for testing is to contact your primary care doc, have a telemedicine visit, and they will indicate whether testing is needed or not.
We know that you can only see a certain number of people. You have tents for this overflow. Tell us how important the next 30 days is, not only for the people in the categories you've been describing, but for everyone, so that these tents can actually still take the number of people that will be coming as we see a surge.
Yeah, we are expecting the surge. I have to say San Diego County specifically has done much better than most metropolitan areas in the United States. The number of new cases increasing. We're over 3 weeks into this now since our first case, and the number of new cases in the county is still fairly flat, which is great. That means everyone's doing a good job with social distancing. We are prepared to see potentially hundreds of patients in these tents every day. Our hope is that we don't need to do that work if we all do a good job maintaining social distancing, avoiding unnecessary travel, and keeping family units separate from one another on home isolation. Our goal is to what's called flatten the curve and allow this virus to burn out before it burns through a significant portion of the population. So far, San Diego is doing very well with that.
Just to follow up on that, Dr. Efantides, you are an urgent care doctor. That is your specialty. And how important is it for these at-risk populations that you've been referring to stay isolated right now and let the medical facilities, such as this new tent, the equipment, the medications, and all of that catch up with the capacity?
Yeah, we still need a little more time. Our system at Sharp Rees-Stealy, we are prepared. I have to tell you, many other systems are not as prepared. So we still need time to get these tents in order. I can tell you the ERs and the hospitals will be the first part of the healthcare system to be overrun. So our goal is that those who don't have significant illness stay home, isolate themselves. Even if they have fever, if their illness is not that significant, contact your doctor by phone, and your doctor can provide care and advice over the phone to protect your safety and also the safety of others that absolutely need to be seen in person. So that's the message, and so far I have to say San Diegans have done a remarkable job compared to other parts of the nation.
You're giving life-saving advice. Thank you, Dr. Phil Ephantidis, and we wish you all the best with this new tent system that you have with Sharp as their medical director. Thank you for your time this afternoon.